Conversations about health equity often overlook people with intellectual disabilities. At the 2018 American Public Health Association annual meeting, the Special Olympics Inclusion Revolution reached a broader audience of healthcare professionals.
How do we get folks that are living or experiencing intellectual disabilities to inform the process? And I was out in Seattle at the Special Olympics event back in June, and I saw these fantastic folks get up there and just tell their own stories, and I'm thinking, that's what we're doing at APHA. Yeah, I couldn't be more pleased that the Surgeon General was here today. It brings so much more visibility. To have somebody with the stature of the Surgeon General talk about this, you can't get a broader audience.
The Special Olympics Health Messengers spoke about barriers to health that people with intellectual disabilities face and how to address them.
But what makes it most difficult to be healthy? Typical people don't know how to deal with those with intellectual disabilities. I've seen that a lot.
I've also had trouble finding doctors that are willing to work with me and help me understand what's going on with my health and my body and not talking down to me because I have a disability.
I remind myself to never give up and just to keep on trying. There may be some setbacks, but I just pick myself up and go on.
It is the responsibility of public health professionals to ensure the dialogue on health equity also includes intellectual disability, which tends to fall through the cracks in discussions.
Let's face it, most of society either intentionally or unintentionally excludes people who are different.
Everyone has exactly what you need to incorporate inclusion, and all you really need is a desire to do so.
Special Olympics, along with our partners, is working to remove the barriers to health services and programs for people with intellectual disabilities, so they can be healthy and productive members of society. Everyone needs to do their part to make this possible.
Everyone has the same right to health.
We may worry that we're not competent to take care of people with intellectual disability, but in reality, the first step is being comfortable and just having a simple conversation.
If you haven't started to make your practice inclusive, what are you waiting for? The Center for Inclusive Health, inclusivehealthcenter.org, has resources for public health organizations to take the first steps to becoming inclusive. Don't be left behind as the inclusion revolution takes hold across the world.
I just want to say, this is what awesome looks like.